So here we are back with Karen. Hi, Karen. How are you doing?
I'm good. How are you?
I'm doing well, thanks. We've got great weather. Spring really was on cue for us here. How about you out there?
It's actually been really nice, except for today. It's dreary, but it's been warmer, so that's
That's
exciting.
great. Yeah, yesterday here was dreary and rain, so hopefully you'll get the sunshine we're getting towards your way. I'll just mention that Karen is in Massachusetts, right?
Yes.
Right. So okay, so I'd like to talk about the Ilizirov. For those who are unaware, Dr. Ilizirov developed this external fixator to help repair deformed bones, bones that were crushed in accidents, and to lengthen the bone if possible, therefore, making the bone better, especially in a child who suffers from Ollier's disease. Bryce was a recipient, Yehu, of the Ilizirov, the external fixator. And he had it on his arm, if I'm correct,
Nope.
and his leg,
He
just
had it
his leg,
on his leg twice.
twice. Okay, go ahead. Tell us about the first time, please.
Okay. So the first time he had the external fixator on, it was discovered that because of the way that he had broke his femur prior, and they had to offset his bones. So it kind of made his bones like twisted a little bit, which in turn had affected his like knee and, all that. So they weren't just lengthening, they were also trying to turn his leg back out or straighten it out so that he wasn't so knock-kneed. So we were doing two different things. So I remember the surgery and him coming out and, being
If I can, sorry, Karen, how old was he here at this for this first one?
I'm going to say, I wish I had the exact age. Maybe 9.
Okay.
To be honest, I'm thinking around
No,
9.
I get it. When you have that so many in a short time, believe me, I know. So,
Yeah.
okay, carry on.
Okay.
So we'll say 9ish.
Yeah, we'll say 9ish. So I remember him coming back to the room, and he unfortunately had a horrific experience because what they do is they actually put in a nerve block, and that's because of the traumatic surgery. It's horrible. And the nurses were coming in and I'm saying something's wrong. He's in so much pain. What's going on here? And they were like, oh, no. The block should be working, whatever. And I'm like, well, something's wrong. It's not working. So the poor kid went through a whole day before they ended up bringing him back down to the surgery area. And they ended up doing some tests to, like feeling tests to see if he could feel things. And he could feel all those things. So they had to go back in and put a new block in.
Oh my God. And if I can here interrupt, one of the damnedest parts is when a healthcare worker doesn't listen. There's nothing more infuriating and heartfelt when your child's suffering. I'm right. Speaking for not for even just me as the mom. I'm not the patient. I was the patient. So, right. But I had nurses like that. Oh, you can't be, no, that's just not, blah, 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 blah. So that alone is a struggle to get through. So, and I just wanted to bring that up to people because I'm talking a lot about here when I was younger in the 60s and 70s and 80s. And of course, but things haven't changed very much then. If nurses cannot understand chronic pain or that pain is actually happening
Right.
to,
Yeah.
to somebody. So
Yeah.
carry on. Sorry.
So-
Thank you.
It's so heartbreaking.
It is.
So we ended up getting all that straightened out. The block worked. Of course, ended up being in the hospital for a couple more days longer because of that. Because they had to get his pain under control.
So
And
the
then-
meds, of course, narcotics
Yep.
at 9-ish years old.
Yep. Yep.
Another issue.
Oh my God, yes.
Yep.
So when we were finally able to go home, of course, you don't start the lengthening right away. But I think it's like maybe a week or so before you can start doing the actual lengthening. So we started doing the lengthening and, you know, and it was very painful. But before I even get to that, let me go back a little bit, because one of the worst parts is the cleaning of the pin sites.
Oh,
Because these poor kids and adults, whoever get this, you know, who get this done, the skin
grows
will grow up in tent
onto the pin.
So every day, to keep that from happening, you have to go in and you literally have to push that raw skin down and you have to clean it. And it is, you'll feel like the worst parent in the world.
And you didn't
Have to do it.
did you get to freeze him?
No. No.
See, when I had mine, I didn't, of course, the Ilizirov was not available. It was probably in the making, but
Right.
I had the Wagner device, which is basically the one with the two big rods and the
Yep.
outer thing. I had that on the lower part, had to turn it half a knob a day.
Yep.
Anyways, the skin started growing. They didn't know what to do. This was all new. I was a guinea pig.
Right.
So they came in, they froze me at the sites and took a scalpel and did a little stars, pushed it down, put a bandage around it, and let it be until it grew again. I eventually did it to myself a couple of times, because you have to remember, I was in the hospital 3.5 months for this procedure. I wasn't home.
Right.
My parents didn't get to experience your joys.
Right. Yeah.
So, and that's a big difference
Oh God, yeah.
on both sides. I was alone.
Yeah.
So there's a, you know, the two aspects, but I remember clearly. And when I saw your great video and the sights, and my heart just, chill, because I know. And for you, like, to you, you know what I mean? So it's, and with the external fixator Bryce had, there's more than 4 sites.
Oh yes.
I had only 4 sites. So yeah, go on with that wonderful chore of yours.
Yeah. So that had to be done at least twice a day.
Oh my gosh.
So we ended up, you know, we were doing those things and it was just so heartbreaking. And, you know, he would cry the minute I said we have to do this, or, you know, he would see me getting all the stuff together, the gauze and, you know, the hydrogen peroxide and whatever else I was using. And he would just cry and cry and cry. And there was nothing I could do. I had to do it. Even with me being so cautious and doing it twice a day, he did end up getting an infection. And then they put them on this most horrendous medicine, like antibiotic, which makes them have to go to the bathroom.
Oh.
And he's got this, you know, huge fixator on his thigh. You know, how do you go to the bathroom?
I know.
It's like, oh my God, it was horrible.
I'm surprised they put it on his thigh. I really am.
Yeah.
That was something.
Well, it went around his whole leg.
It went from the thigh down at once.
So it was, you know, it was
all around the
circle.
part of the femur.
Yep.
Yeah.
It was 32 inches around.
Yeah, I seen the picture, but it didn't go down below his knee.
No, just on
No,
the
it was that whole femur area, exactly.
Correct.
See, and that's where my area is, the bow in the bone, the crookedness in it. It was all there, but my original doctor, who was retired at the time but still followed me, said no, there's too much weakness in that bone
Yeah.
to do that. It's gonna, you know, and especially I mean, I think at this point I was about 12 or 13 and close to my age growth finishing, which is key as well. So, but that could be, how many sites did you have?
Oh God, let's see. We had, well, there was one pin that went straight through his one side of his knee and out the other.
Oh
So
boy.
there was that one. There was one that was right on the very top that went straight into the femur. And then another one that was a little bit further down in the front. Oh God, one's on the sides.
Sides, yeah.
Yeah, both in, inside the thigh and outside the thigh. I'd have to look at the picture, but
I know the picture says it. There's
Quite a few.
quite a few, and that's the whole part of that fixator.
yeah, definitely.
Because of the springs and the way that because it's circular, it can do
Exactly.
this. You know, while your brain is going this, you know, with the Wagner device that I had, my worst part was infection. They had to open me up to reach part of my bone for something with the fixator.
Yeah.
And when I got the infection, that's where it all poured out of the side. I have a huge dent in my leg because of it. It was just a stream of pus.
Oh yeah.
And one day I turned the knob just a little too much and I bled out. My parents found me white as a ghost, nearly dead. I remember the blood on me, the warmth of the blood. Of course, I required blood transfusion. I remember being so weak and trying to ask my mom what was going on. And then years later, I found out that the blood transfusions gave me Hep C. So it's a vicious circle, you know what I mean? It can never end sometimes. So, now that was the first fixator for Bryce. How long was it on for?
So for him, he had, so we were, when we first started doing the lengthening, I would say for about a week or two, it was okay. And then it started to get like so painful. And we were like, is this normal? Why is this hurting him so much? Blah, blah, blah. So they said, all right, well, come on in and let's take a look. So we went in and they did the x-rays and they saw that the bone was already forming together.
Okay.
Now, in essence, what we were doing is we were actually breaking his bone that was already formed.
Trying to fuse, and you're tearing it apart as it's trying to fuse.
Exactly.
Oh.
So, and I guess, and that's when we found out that with Ollier's, one of the things which is just so odd is that the bone, when it breaks, tends to grow back really quickly.
Really quickly.
Yep.
It does.
Right. Which is, to me, is just so odd.
It's amazing. Very, very strange. It's like, but it's also the cartilage part that doesn't really grow back properly.
Exactly.
And the bone isn't as strong as
Correct.
well, unfortunately.
Right.
So, okay, so carry
So
on.
we ended up, so the doctor said, okay, so what we have to do now is we have to double up on the lengthening. So instead of just turning it like 1 millimeter or whatever, we have to do it 2. So we had to get a whole new schedule. And they give that to you at the hospital. They tell you, which number to turn, how many
Oh
clicks,
my gosh.
blah, blah, blah. So we started doing that. And it was okay again for a couple of weeks. And then it was just like, he was just so miserable and so much pain. He had muscle spasms like you would
Oh,
not believe, nerve pain. I
oh
mean,
yeah.
it was just awful. So we ended up going back again, having them look at it, and they said, you know what, I think we're just going to have to stop. So I believe it was just about 2 months he had it on, which was shorter than he was supposed to.
Supposed to, yeah.
But he said, you know what, let's just stop. We're
Yeah.
torturing the poor kid.
Yeah.
So we stopped. And then it was probably a week later that we went in and they took it off. And he was also getting these strange rashes, like it was weird. So they said, yeah, let's just take it off. So I said, okay, let's do that. And then when he took it off and he came out and he talked to us, he said, thank God we did, because his poor tendons and muscles and stuff couldn't have stretched anymore. He
Oh
said
my
they were
God.
beyond tight. And
They
so,
would have snapped.
yeah, he said like we made the right decision.
Oh my
So
goodness.
thank God.
And you know what? Bryce's expressing his pain was for a reason.
Exactly.
It was for a reason. Yep.
They know their bodies. They know their
That's
bodies.
exactly. Yes. Yep.
Definitely. So from there, because we had to take the fixator off, I think it was maybe, I'm going to say about 2 months, maybe 3 months after he had that removed, they went in and they put a plate, the length of his
Yeah.
femur with screws in it
Yeah.
for the support.
Right. Yep.
So he had that done. And, that
Have
was,
you saved any plates and screws?
oh yeah. Oh yes.
Yep.
Definitely.
When I had my knee replacement, I asked if I could keep my knee,
Yeah.
and it's against the law
Yeah.
to keep human bones, unfortunately, even if they're your own.
Yeah, exactly. Yeah, right.
Oh, okay.
Yeah,
Well,
exactly.
but yes, I have pins, and we used to joke that if I would have kept all of my casts,
Yeah.
I would have a museum
Oh
to
yes.
show off of art on casts and so on, so,
Exactly.
but,
Yes, we did the
and,
same
and
thing. We saved them all. Yeah.
yeah, and you know what, as much as they're, part of this horrible journey, look at the joy they also bring us too, because they do represent, the strength, the power, how far someone has gotten. And
Right.
again, I go back to why I want these educational scholarships.
Yeah.
And I just want to throw that out there. We're going to be cutting short. We only have a 30-minute period. So I just want to make sure that we get that out there. That Bryce is our first ever recipient, or male recipient. He's in the US. We do have one in Canada. Angelina will be meeting with her shortly, later on, actually tomorrow, meeting her mom, Crystal. But as I mentioned in the other episode, these scholarships to me represent strength, courage, warrior who will excel and conquer
Absolutely.
And I truly believe that, you know, especially in Bryce, you know, I think that kid, just by knowing him this kind of way, what
Yeah.
I've seen of him, and I so look forward to talking to him. It has been great. It's I've gotten to learn more about the disease myself, and just the fact that someone else has it blow my mind
Right.
kind of thing. So, you know, so is there anything you want to wrap up with? So we will, as I believe we've mentioned, we will continue these episodes a little more. As I do want to speak with Bryce at one point. Yeah, so how would you like to finish off, Karen?
I just wanted to say that, you know, we are beyond grateful for all the work that you're doing. I know you're in Canada, but you know, to be extending this to us in the US is just really touches my heart.
Thank
Like
you.
yeah.
Thank you.
Thank you so much.
I appreciate that. I really do.
We really do appreciate it. So thank you.
Okay, back at you, and we'll talk again soon. Big
Okay.
hugs to Bryce. I'm glad he liked the balloons.
Yes, he did.
I was so, when I said I have something a little special, it's not big, but when I saw them, I thought that's pretty cool. So,
cool.
okay,
Yeah.
until next time, you take care.
Thank you. You
Thank
too.
you. Okay,
Bye-bye.
bye-bye.